Tearing an ACL can happen to anyone, whether you're an athlete or not. But if it does happen to you, just know that the following process is the most effective way into healing a torn ACL by following these 3 significant steps. One of the most important steps into fixing a torn ACL is to have surgery, but having therapy before and after surgery are just as important as having surgery. According to many physical therapists and surgeons, the following process is the most effective way into healing a torn ACL. Let's begin with the first step. So the first step of healing a torn ACL is to go through therapy. So according to the Journal of Orthopedic Sports and Physical Therapy, in a study of 100 people in a 5-week program showed great improvement when they did short-term exercises for this amount of time. So another benefit of going through therapy before surgery is that most of the exercises done before surgery are also the same exercises done after surgery. So this benefits the patients because they're already accustomed to the therapies that they're doing, and it just prevents confusion, and they're already expecting these therapies after surgery. So let us begin with step 2. Step 2 of fixing a torn ACL is actually having and going through surgery. So in some rare cases, there will be doctors who will give patients the option of whether or not to go through surgery, because in these rare cases, there are actually some people who can walk even though their knee ligament is completely torn. Some of these people won't experience pain or anything like that. So doctors will say that they don't have to go through surgery, but these options are only given to those people who will less likely be active or are much older and won't be as active later on in the future. So what happens in the ACL surgery is a muscle tendon graft is what replaces the torn ACL. So according to the Open Access Journal of Sports Medicine, the patella tendon, which is what connects to the knee, and the hamstring tendon are the tendons that are given as options to replace the torn ACL. So altogether, the reconstruction surgery takes about 2 hours max. So now we will move along to step 3. The third step of fixing a torn ACL is going through therapies. This is finding the last step, it's finding the last therapy session that patients will be going through, and it is called post-operation rehab. So according to orthopedic surgery, the main focus of going through therapy after surgery is to prevent muscle atrophy. So what happens after surgery is you're basically on crutches for around 3 days. So because you're not walking on your knee, you are losing quadricep muscle. So going through therapy right as soon after you have surgery prevents extreme muscle loss. So the whole amount recovery time after surgery is about 6 to 9 months, with the first month being extremely crucial because it focuses on your flexibility and your extension. So basically this is called range of motion, and if you don't focus on your first month of therapy, you will not fully be able to regain your flexibility and your extension. The 2nd to 4th month focuses on strength and balance, and finally the 5th through 6th month focuses on strength and conditioning. Altogether, these 3 steps make up the ACL reconstruction process. So once again, this ACL tears can happen to anyone, and just know that you will be able to fix it if you follow these 3 significant steps, which is going through therapy before, having surgery, and having therapy at the end. Thank you.